Did you know that a persistent itch in specific areas might be your body's subtle way of signaling a serious issue like cancer? Many of us dismiss occasional itching as nothing more than dry skin or irritation. But for those over 60, certain itchy spots could be a warning worth heeding. In this video, we'll reveal 5 specific places on your body where persistent itching might point to cancer, sometimes months before other symptoms show up. These aren't just random itches. They're patterns doctors have noticed repeatedly in patients later diagnosed with conditions like lymphoma, pancreatic cancer, breast cancer, or skin cancer. Stick with us until the end, as we'll not only pinpoint these areas, but also explain why they itch, which cancers they're linked to, and how to distinguish a harmless irritation from something more serious. You'll leave with clear steps on what to watch for, questions to ask your doctor, and actions to take if these signs feel familiar. This isn't about fear, it's about awareness. Catching these quiet signals early can make all the difference in treatment success. Let's dive in. Sign 1. Persistent itching on the lower legs. If you're constantly scratching your shins or calves and there's no rash, dryness, or new product to blame, it's tempting to chalk it up to aging skin. But for older adults, this specific lingering itch, especially one that worsens at night and resists lotions, can be an early clue of blood-related cancers like lymphoma. Unlike typical dry skin, this itch feels deep, almost burning, and the skin often looks normal despite the discomfort. Why does this happen? Cancers like Hodgkin's lymphoma, which start in the lymphatic system, release inflammatory chemicals into your bloodstream. These chemicals irritate nerves under the skin, especially in the lower limbs. Take George, a 75-year-old who shared his experience at a cancer awareness event. For 6 months, his only symptom was an intense itch on his lower legs. Initially dismissed as eczema or a detergent reaction, blood tests later revealed abnormal white cell counts, and scans showed swollen lymph nodes in his chest, leading to a lymphoma diagnosis. His itch was the first sign. While not every itchy leg signals cancer, the key is persistence. If there's no obvious cause like bug bites or new soaps, and the itch lasts weeks, especially with night sweats, fatigue, or weight loss, it's time to see a doctor. For older adults, our bodies don't always send loud signals. A stubborn itch might be the first whisper of something deeper. If you're scratching nightly with no relief, don't ignore it. Ask for blood work and mention the pattern. Listening to these whispers can be life-changing. Sign 2. Itching between the shoulder blades or upper back. A nagging itch in the upper back, especially between the shoulder blades, is easy to blame on dry air, posture, or even a scratchy shirt tag. But when it feels like it's coming from deep within and persists despite moisturizers, it could be linked to pancreatic cancer, often months before pain or digestive issues arise. How does a pancreatic issue cause a back itch? Tumors in the pancreas can block bile ducts, which carry bile from the liver to the intestines. When bile backs up, salts build up in the blood and irritate nerves, particularly in the back, where sensory nerves are dense. Linda, a 70-year-old, described a phantom itch on her upper back that woke her nightly. Lotions, back scratchers, and even a new mattress didn't help. Blood work for unrelated fatigue showed elevated liver enzymes, leading to scans that found a small pancreatic tumor pressing on her bile duct. That itch was her only symptom. No pain, no jaundice, just a relentless sensation. If your itch is focused, deep, and unresponsive to skin treatments, especially alongside darker urine, pale stools, or tiredness, it might signal an internal issue. For older adults, these subtle signs are easy to dismiss, but your body is smarter than you think. If this sounds familiar, don't hesitate to speak up. It could be your back acting as a messenger for your gut. If you're finding this helpful, please drop a 2 in the comments to let me know you're watching. And if you haven't already, hit subscribe and the bell icon to stay updated. Your support keeps us creating content to inform and empower you. Let's move on. Sign 3. Itchy scalp without flakes or dandruff. An itchy scalp might seem like no big deal. Maybe it's dry air, aging skin, or a harsh shampoo. But when the itch persists without visible flakes, redness, or dandruff, it could point to something deeper. like leukemia or scalp-related skin cancers. This itch often feels like a tingling, crawling, or burning sensation, moving around the scalp and resisting treatments like anti-dandruff shampoos or oils. In older adults, this can stem from abnormal immune activity caused by leukemia cells multiplying in the blood, triggering nerve irritation. Henry, 73, noticed his scalp itching every afternoon. He tried new shampoos and stopped wearing hats, but the itch stayed. A routine blood panel for fatigue revealed high white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. His scalp was his body's first alert. For those over 60, scalp sensitivity is common, so it's easy to ignore. But a cancer-related itch stands out. It doesn't respond to creams, feels deeper than surface dryness, and may pair with fatigue or easy bruising. Skin cancers on the scalp, especially in thinning hair areas, can also start as a small, itchy patch. Ask a partner, caregiver, or hairdresser to check your scalp regularly. If the itch lingers for weeks and feels unusual, see a dermatologist or request a blood panel. Small signs can tell big stories. Sign 4, itching on the chest or breast area. Persistent itching around the chest or breast, especially near the nipple or under the breast, can be mistaken for sweat, tight clothing, or thinning skin. But for older adults, both women and men, this could signal inflammatory breast cancer or tumors near the chest wall. Unlike typical itches, this one may come with warmth, tightness, or slight skin changes, like roughness or redness, though sometimes it's just a deep, nagging itch. Ruth, 69, felt an odd itch on her right breast that persisted despite changing bras, detergents, and even going braless. Her doctor noticed subtle skin dimpling, and tests revealed a small, aggressive tumor near the skin surface. No typical lump. Inflammatory breast cancer often mimics rashes and spreads quickly, with itching as an early clue. Men can also develop breast cancer, though rare, and may overlook itchy patches or thickened skin near the nipple. This itch might also stem from swollen lymph nodes under the arm or collarbone, hinting at lymphoma or other malignancies. If you notice swelling, warmth, or a heavy feeling alongside the itch, don't wait. Early detection starts with noticing these subtle patterns. Your skin is signaling. Listen to it. If this resonates, comment 4 below to show you're here. And please subscribe and hit the bell to support more content like this. Let's keep going. Sign 5. Persistent itching in the anal or genital area. Itching in the anal or genital region is uncomfortable and often embarrassing, so it's no surprise many older adults ignore it. But when it's chronic, with no clear cause like hygiene issues or infections, it could point to anal, vulvar, or penile cancer. This itch feels raw or burning, persists despite creams or hygiene changes, and may focus on one spot. Eugene, 76, thought his anal itching was hemorrhoids. After a year of unsuccessful treatments, a colorectal exam found a small tumor in his anal canal. Similarly, vulvar cancer, more common after 60, often starts with a relentless itch in the outer genital area, sometimes with rough or discolored skin. Women may mistake it for postmenopausal dryness, but if treatments fail and the itch worsens at night, it's a red flag. This area's dense nerve endings make it a sensitive signal for internal changes, like abnormal cell growth or lymph node swelling. Don't let embarrassment stop you from speaking up. An early checkup could catch something serious. If the itch persists for weeks, see a healthcare provider. Small symptoms can lead to big discoveries. Final thoughts. Your body is always talking to you, sometimes through pain or fatigue, but often through something as subtle as an itch. The 5 areas we covered, lower legs, upper back, scalp, chest, and genital region, are key spots where cancers like lymphoma, pancreatic, or breast cancer may send early signals. For older adults, recognizing these signs can be the difference between early treatment and a tougher battle. This isn't about living in fear, but trusting your instincts.